So I'm the chief for the Division of Hematology and Hematologic Malignancies at the University of Utah, and I'm the director for the Center of Excellence for hematology and heme malignancies here at Utah. My specialty is hematology, specifically malignant hematology, and I have worked mainly on myeloid leukemias such as CML, myelofibrosis, and acute myeloid leukemia. I think we all have to make reasonable assumptions and take reasonable decisions based on incomplete evidence. So I believe it's quite plausible that patients who are immunocompromised will have a higher risk of acquiring COVID-19 infections, and they may well have a more severe course of the virus. But I don't think there is really good and hard data to support that at this point. And that makes it very difficult to give clear-cut recommendations. So some people in the myeloid malignancies field led by the University of Yale have just put together basically a white paper of recommendations that will hopefully be published in the not so distant future that gives some guidelines. So I would say that as practicing oncologists, everybody know that treatments are very different in terms of how severely they affect the immune system, from things like tyrosine kinase inhibitors, which are quite safe in terms of immunocompromise, at least as far as CML is concerned, to aggressive chemotherapy, which makes people extremely liable to infections. So I think this is something new that we haven't experienced to this degree. I think it's a little bit similar to, say, influenza hitting a population that has no immunity. And I think we are just not quite sure how this is going to play out. So I think one clear-cut recommendation is to participate in clinical research along these lines so that we better understand how this particular virus affects patients exposed to cancer therapeutics and so forth. So, but basically try to create a knowledge basis as soon as possible and as quickly as possible so that we can make educated decisions. Well, there's a lot more telemedicine. So we've been reducing in-person visits a great deal. Telemedicine visits, phone consults. In a way, I think it's accelerated that process that was underway already in a very major way. And clearly volumes are down. So I think many academic medical centers, or of course, really any practice, medical practice, has seen that drop off in volumes. That is quite dramatic. Some more elective procedures have been postponed where it seemed safe to do that. I'm not a surgeon, but I know that clearly some low risk, say, breast cancer surgeries have been postponed. And again, that is just a weighing of risks versus benefits. But I think all of us are kind of used to that anyway, because it applies to any decisions we take. I think the key to reducing anxiety is to be honest, fully transparent, and that includes to share both what you know and what you don't know. I think to be very much to the point, not to sugarcoat things and not to dramatize things at the same time is critical. Keeping the patient informed and trying to do as much as possible over telemedicine channels to keep patient confident that they're not forgotten, that the care continues even if the circumstances are clearly quite a bit more challenging. I think the really big fallout that will happen when we realize how many patients lost their health insurance and will be affected by that, and their treatment may be affected by that. I think this is a wave that is really not yet fully visible, but this could have much more dire implications in the long term. That's a really good question and not so easy to answer, because I think what we see at the moment is that there is an incredible amount of information out there, but not all of this information is reliable, and it's almost an overcrowded space. So I think patients trying to inform themselves will have a hard time picking reliable information sources. So I would think that one important element of addressing it would be to try to collaborate as much as we can and come up with consensus guidelines or consensus recommendations that are supported by multiple bodies, so that we don't overcrowd the space and make it hard for people to pick amongst the many options. So the professional societies are working on that, and I think we should all be supportive of that. Patient advocacy groups are part of many of these major organizations, and of course they will be critical to provide a patient perspective as these recommendations are coming out. I imagine especially the psychosocial circumstances that are an important part of living through these times. So I'm thinking about the very restrictive practices in terms of visits that a number of centers have implemented and really, had to implement to safeguard their patients, which is hard for family support and is really not so easy to understand sometimes. So I think we need to work on convincing, understandable, and very truthful messaging that gets the support of large parts of both the medical community as well as the medical provider community, professional societies, and the patient advocacy groups. Maybe one additional thought would be that, as you know, there are patient support organizations that are quite disease specific. So in my field would be, there's a CML Foundation, for instance, there's an MPN Foundation, there's the Mastocytosis Society. So a lot of these recommendations will be across the board. And I think these societies or these patient advocacy organizations should also work together to come up with a uniform messaging strategy so that we don't add yet more to the confusion. Well, to my own specialty, I've worked a lot on CML, and one interesting question in CML is that there is some circumstantial evidence from studies in virology that tyrosine kinase inhibitors that you use to treat CML may actually prevent some coronaviruses from entering the cells or from replicating in cells. So one question that comes to mind is whether maybe CML patients are actually protected from COVID-19 infections in some way. So that's, I guess, an interesting question that we need to answer. I think what will be very important is to understand the risk of transplant patients, that is, patients post-allogeneic stem cell transplant, many of whom are still taking immunosuppressants, or some may have chronic graft-versus-host disease. And so these are extremely fragile patients. And so working out how to protect this particularly vulnerable population will be important. In the absence of vaccination or in any treatment strategy that would stand the test of medical or scientific rigor, it is really tough to make good choices other than those that are obvious, and that is to reduce the infection risk by reducing exposure to potential infectious sources as much as you can. Clearly, this is unprecedented, and so it's going to be a steep learning curve for all of us.